From VOA Learning English, this is the Health Report. The World Health Organization says vaccinations against disease save the lives of 2 to 3 million children every year. The WHO says almost 80% of babies are vaccinated against preventable diseases like diphtheria, measles, and whooping cough. But 20% are not protected. That is about 22 million children. That is why many efforts to end polio and measles have not succeeded. Jean-Marie Okwobele is Director of Immunization for the World Health Organization. He says one problem is that the cost of newer vaccines is too high for poor countries. Most of the unvaccinated children live in Africa and Southeast Asia. 80% of them live in just 10 countries. The list includes Nigeria, the Democratic Republic of Congo, India, Indonesia, and Pakistan. Dr. Okwobele says limited resources for health care systems also reduce the ability of poor countries to vaccinate children. For example, some countries are not able to store vaccines at cold temperatures until they can be used. But the official says there are some improvements in getting vaccines to clinics and children. Dr. Okwobele says a new vaccine against meningitis A in Benin and West Africa has been designed to remain effective at warmer temperatures. The WHO says governments need to vaccinate more children. The UN agency also says health officials and governments must do a better job of telling people about the benefits of vaccines. Dr. Okwobele says that includes making sure people understand that many stories about vaccines are not true. For VOA Learning English, I'm Laurel Bowman.
From VOA Learning English, this is the Health Report. The World Health Organization says the deadly disease Ebola is spreading in West Africa. The situation frightens both local people and travelers. There is no vaccine or cure. And the Ebola death rate is very high. The WHO says that the disease has killed more than 500 people in West Africa. Ebola spreads easily. It can move from infected animals to people. It can also pass from person to person through direct contact with body fluids. The remains of Ebola victims can also contain the active virus. Doctors say it is important to identify an Ebola case early to prevent the spread of the virus. Signs of the disease include a high body temperature, bleeding, and diarrhea. Only a few prevention measures exist. The United States Centers for Disease Control and Prevention and the WHO suggest staying out of countries with confirmed Ebola cases. Doctors advise protective measures for people who must go to an area where Ebola exists. They advise to wash hands often with soap and water. A hand sanitizer or cleaner containing at least 60% alcohol is a second choice. Experts also advise against eating or handling primates, bats, and other wild animals. And they warn to stay away from places where bats and other infected animals might live. The CDC and WHO strongly suggest wearing protective clothing when near infected people. Cover your face and hands. Goggles can help protect the eyes. Health experts have confirmed recent Ebola cases in Guinea, Liberia, and Sierra Leone. There have been at least 37 deaths in those countries. For VOA Learning English, I'm Carla Babb.
From VOA Learning English, this is the Health Report. Why do we need sleep? Do our brains turn off for the night? Scientists recently discovered that our brains may be just as busy at night as they are during the day. While we sleep, our brains are doing much more than getting ready for the next day. Researchers at the University of Rochester found that the brain may be busy cleaning out harmful waste materials. The researchers studied mice that had colored dye injected into their brains. They observed the brains of the mice as they slept and when they were awake. The researchers say they saw that the brains of sleeping mice were hard at work. Dr. Macon Nedergaard led the study. He says our brains perform two very different jobs. He says when we are awake, our brain is hard at work processing information about our surroundings. But at night, our brain works to remove all the waste that builds up during waking hours. The researchers say the waste material includes poisons or toxins responsible for brain disorders such as Alzheimer's disease. They also found that during sleep, the brain's cells shrink. This shrinking permits waste to be removed more effectively. The brain's cleaning system could only be studied with new imaging technologies. And test animals must be alive in order to see the brain process as it happens. Dr. Nedergaard says the next step is to look for the process in human brains. She says the results show just how important sleep is to health and fighting disease. The research may also lead to treatments that prevent or help fight neurological disorders. For VOA Learning English, I'm Alex Villarreal.
From VOA Learning English, this is the Health Report. The World Health Organization says everyone should have a right to the health care services they need without risking financial ruin. A new WHO report is urging countries to provide health care designed to meet the needs of their citizens. In 2005, all 194 members of the World Health Organization set a goal of providing universal health coverage. But very few countries have reached that target. most people must use their own financial resources to pay for the health care they need. Since health care needs differ from one country to another, the new report urges every country to create its own system of health coverage. It says the services should include prevention, treatment, rehabilitation, and reduction of pain. And the health care should involve communities, health centers, and hospitals. Christopher Dye is head of the WHO's Office of Health Information, HIV/AIDS, tuberculosis, malaria, and neglected tropical diseases. Every year, he says, about 150 million people face extraordinary medical expenses that they cannot pay. The question, he says, is how to put in place financial risk protection that reduces costs to a minimum. The report shows how research can help countries improve their health system. Dr. Dye said some European countries have continued supporting their social and health services even during this period of financial difficulty. He says that decision is paying off in better health for their people. Dr. Dye notes that the cost of medical care is increasing quickly. Because of that, he says, governments must work harder to keep costs under control. For VOA Learning English, I'm Laurel Bowman.
From VOA Learning English, this is the Health Report. World Health Organization experts recently reported that eating processed meat can cause cancer. Processed meat is meat that has been preserved by curing, salting, smoking, drying, or canning. Experts from the WHO's International Agency for Research on Cancer in Lyon, France, studied 800 cases. IARC researchers linked processed meat, such as hot dogs and ham, to bowel cancer, as well as pancreatic cancer and prostate cancer. The IARC has placed processed meat in the same category that it placed tobacco, asbestos, and diesel fumes. WHO experts also called red meat, including beef, lamb, and pork, probably carcinogenic to humans. Dr. Kurt Strafe is with the IARC. He said that the risk of cancer increases with the amount of meat a person eats. Dr. Strafe said, eating 50 grams of processed meat per day increases a person's risk of bowel cancer by 18%. Health experts in some countries already advise against eating large amounts of red and processed meat. But those advisories have centered on the increased risks of heart disease and obesity, not cancer. Meat industry groups are protesting the WHO study. They say meat is part of a balanced diet. They also argue that the causes of cancer are broad and include environmental and lifestyle factors. The WHO report said the Global Burden of Disease Project estimates that diets high in processed meat lead to 34,000 cancer deaths per year worldwide. For VOA Learning English, I'm Ann Ball.
From VOA Learning English, this is the Health Report. Rabies is a viral infection that people get mainly through dog bites. The virus kills about 70,000 people around the world every year. Most of the victims are children. Rabies is uncommon in the West, but in India and other parts of Asia and sub-Saharan Africa, dogs that have not received anti-rabies vaccines continue to threaten public health. A rabies death is a painful process. After a rabid dog bites someone, the virus invades the person's central nervous system. Victims develop a severe fear of water. They convulse or shake violently. Then they go into a coma, an unconscious state. The result is usually death. Scientists say vaccinating dogs can effectively end rabies outbreaks in dog populations. That would lead to fewer humans with rabies. But many developing countries do not have dog vaccination systems in place. Animal scientists are calling for the mass vaccination of dogs. One example of where this plan has worked very well is the African country of Tanzania. Public health officials there set up dog vaccination centers in 180 villages. As a result, the number of rabies deaths a year in Tanzania dropped from 50 to almost 0. Guy Palmer is director of the School for Global Animal Health at Washington State University. He says that rabies could be permanently ended within 10 years with a method called One Health. The method brings together medical doctors and animal doctors called veterinarians. They immunize dogs against rabies and treat dog bite victims. Mr. Palmer says a successful anti-rabies campaign strengthens medical systems. For VOA Learning English, I'm Alex Villarreal.